And Jared and Jacob join us this morning for Health Monday. Pharmacists at Marble City Pharmacy. Gentlemen, good morning to you.
Good morning.
Fresh off a trip to the loveliest village of the plains, and tell me it ain't so.
I've basically tried to forget it already.
But you got people like me won't let you, right?
That's right.
I tell you, ladies and gentlemen, we have a topic this morning that the title is so simple, I've asked the simplest of the simple to identify it. Which one of y'all gonna do it?
I don't know. I mean, I feel like he's talking to me. Cholecystitis is the word. I wrote it down for him. I even spelled it for him. But cholecystitis. We're going to start with the pronunciation, so there you go. What's the definition, right? We're talking about this morning because I don't know if we're seeing more of this. I don't want to say that for sure. It feels like we're seeing more of this as time goes on. And as we get to some of the questions and topics this morning, I think you might see some reasons that we're seeing more of it. But cholecystitis, what is it? It's inflammation of the gallbladder, plain and simple.
I was wrong on my guess, wasn't I?
He was wrong on his guess, but that's okay. We'll give you a little forgiveness on this Monday morning. Inflammation of the gallbladder. Well, what's the gallbladder, right? It's an organ that's a little bit below your liver, somewhere on the right side of your body. Let's just say right down in here somewhere. It stores a substance called bile. You may have heard that word before, but bile is simply something that helps you aid in the digestion of your food. Going to get into that a lot more here in a minute.
My son, Matt, suffered from gallbladder attack, and he had gallstones. And is that similar to what we're talking about this morning, Jake?
That is it. So let's put that in longer carrier words. Your son Matt had cholecystitis, which is most often caused by gallstones. So if cholecystitis is the inflammation and an attack in your gallbladder, what causes that are gallstones. And so within this little sac that is your gallbladder that stores the bile, if the bile gets too concentrated for some reason or starts to harden, it forms gallstones. And these gallstones block the little tube that leads away from your gallbladder. And so guess what? You're getting all this into your gallbladder, and now it's blocked to get out. And so it goes up, and and now we have a problem. Yeah. So we have an inflamed, overlarged gallbladder that can't hold the more stuff that's coming into it.
Now, he said that it was most severe pain he'd ever suffered.
You just leading right into the next question. I'm really proud of you.
It's almost like he's done this before.
Yeah.
Or almost like the questions are right in front of you.
I can't read your writing, though. That's the problem.
Okay, how do you know you have this, right? How do you know your gallbladder is inflamed? How do you know that the ducts are blocked by these gallstones? The answer is very simple. It's severe pain, and it's some of the worst pain that you've had in some cases. So generally speaking, the pain could be more in this right area where your gallbladder is formed. A lot of times the pain is right here in the middle of the abdomen, and sometimes it's very tender to the touch. I had my gallbladder removed maybe 2011, somewhere in there, how many years ago that was. I'm still tender right here. So there's pain sometimes happens right here in the middle, very tender, sometimes concentrated to the right, but some people describe it as the worst pain they've ever had. Now, the pain does wax and wane, so it's not there all the time. This is one of the important things for you to remember as trying to figure out what's wrong with you. A lot of times it's worse after a large meal or a meal that's high in fat content. And I'm like you guys, I like some meals that are high in fat content. And so that certainly helped me figure out what was wrong with me at the time.
Did you have the severe pain as well?
I did. I mean, severe pain.
Yeah.
No doubt.
Wow. Now, you're young, and you were younger then, and Matt's kind of young too. So, Jake, who does this affect? Younger people?
Honestly, no. That's just kind of a freak thing. So who gets gallstones? Well, so who gets inflamed? Yeah, inflamed gallbladder is those who get gallstones. Mm-hmm. Okay, who gets gallstones? Gallstones are, by and large, formed by concentrated cholesterol, which is a fat. And so people, and again, you're going to see in a minute as I talk that this is 100% of the time true. He ain't exactly a biggin, but he got gallstones. High cholesterol, whether or not you're big, is a complicating factor. being overweight is a complicating factor. And here's a big one that's pertinent for, and we'll get more into this in a minute, but here's a big one that's pertinent. If you lose weight too rapidly.
Really?
Makes you much more likely to form gallstones, which again is what causes the inflammation and gets us where you're getting it ripped out by a surgeon because it's the worst pain you've ever had. And so those three things are as big as any. Way too high cholesterol, overweight significantly, or losing weight too rapidly and in an unhealthy way. That's your three big ones.
Cholesterol.
Which is a fat.
All right. So who is more likely to have an exceeded amount of cholesterol in their body?
Well, you get cholesterol from two places. Actually, you know what I'm going to quote? I'm breaking every copyright law. I'm going to quote some commercial that used to be on several years ago for a cholesterol medication. It asked, where do you get cholesterol from? And I wish I could quote it, but because it was good. It said, you get it from, this plate of, and it said a hot dog and french fries or something, and you get it from your Uncle Mike. It's genetics. So there are people who have high cholesterol because the day they were born, they were going to have high cholesterol. And there are people who have high cholesterol because the day they were born, they decided they liked Captain D's. Or a combination of the two. And so it's not always just what you eat. Some people just simply have high cholesterol, and that comes out in blood work over the course of your life, and you treat it and deal with it. But yeah, that's where that comes from.
Certainly, dieting can be one way to prevent it, but what are some other ways?
Well, if you're going to break it down, I'll just put it maybe in three categories. Number one, don't fast or skip meals. If you think about this, your gallbladder is kind of on demand. It is storing bile in there to help you digest food, right? And that bile leaves the gallbladder to the small intestine when you eat. If you fast or skip meals, then it can build up and build up and build up. And if there's fat or cholesterol, I think my issue was probably really high cholesterol. I still have high cholesterol, right? If there's fat or high cholesterol, then you may form stones to block those ducts. So that's number one, don't fast or skip meals. Number two is to lose weight slowly. I'm not sure I 100% have my brain wrapped around this, but there seems to be a correlation with people who lose weight too quickly and the formation of gallstones. That is an issue right now with the popularity of these injectable medications for diabetes and weight loss. We've talked about this on this show before, so I'm not going to spend that much time on it, but every other person that comes in the front door or calls on the phone wants to know about these injections for diabetes and weight loss, and particularly for weight loss. When you get on one of those, you still need to lose the weight slowly to be healthy. When you see somebody who drops 30 pounds in 1 month, that person is much more likely to form gallstones. So don't fast or skip meals, lose weight slowly. And then three, I think that this somehow gets worked into every single show, simply eat less fat and get your cholesterol down in the case of me. But so we can work on this with our diets for sure.
Wow. So Jake, how can we treat this?
It's the year 2024. We got a lot of good modern technology, and so what you'd expect is that I would say, well, there's this pill, and you take it once a day with or without food, and there's no side effects, and it dissolves those gallstones, and you just go on about your day. And that's not the case at all. There's a medicine that dissolves gallstones. It takes months to work. So if you're having a gallbladder attack and everything hurts, this medicine's not for you. There's unfortunately one cure, and it does not involve your local pharmacist. It involves your local friendly surgeon. You got to get your gallbladder out. That's really, when it gets to the point where it's hurting and you're noticing you have it, they'll do an ultrasound, they'll see that it's inflamed, and they'll smile and go, so what are you doing this afternoon? Or tomorrow morning, or a day or two.
Depending on how bad it is.
Yeah, they're getting
It's
that
a pretty
gallbladder.
simple procedure nowadays, isn't it?
Yeah, I mean, the definition of a simple surgery is when the other guy's happening.
Yeah.
But yes, in the big scheme of things, it is a simple, safe procedure. Absolutely, the surgeons over here at the hospital pull out gallbladders more often than any of us know. I'm sure it's a very common, simple procedure. And the question then is, well, okay, wait a minute. I had this organ that I need, and you just threw it in that waste bin over there. What do I do? Your liver still produces bile. You still have bile. It can still release bile when you eat. but you don't have this excess built up in this little sac called your gallbladder anymore. So that helps you with the really high fatty meals. So guess what? Once your gallbladder's out and you can eat all you want to, normal all you want to, and your bowel works, but if you eat a really high fatty meal, you can't sometimes keep up and it's got to go somewhere. And so you might not have the most pleasant after effects from a high fat meal. You might need to move quickly.
Yeah, funny how food can affect us, isn't it?
Oh, it's funny.
Yeah.
Before we go this morning, you brought this up.
Uh-oh.
What'd you do?
And I don't want to leave this without, this is such a rage right now with these injections for mainly weight loss. Where did this come from, and can we get a handle on this or not?
Well, it came from, these medicines were created originally in order to reduce a person's blood sugar and treat their diabetes. And these medicines are very effective for that. What we found out after they hit the market is that they also help people lose weight, and the drug companies, being as intelligent as they are, or maybe as money hungry as they are, you guys can interpret that however you want, then begin to come out with very similar medications that were marketed for weight loss and not just for diabetes. And so, as you might imagine, you see the person next to you losing weight in a way, quite frankly, that's easy. Then that's what you want. You want to lose weight in a way that's easy. And so that's why these medicines are all the rage, just as simple as that. But it is true that you can lose weight too quickly, whether it's with those injections or whether it's starving yourself, and that's your method as well. So you don't want to lose weight too quickly. It's not healthy for you. Forget the gallstones. It's not healthy for you anyway. And what we're seeing is people who are losing body mass, they're not just losing fat, they're also losing muscle. That's not good for you. When you lose muscle, then you lose bone density. Now you got another problem altogether. So we could go on for that all day.
You lose a lot of weight, Jacob, and sometimes you look really bad after you lost the weight.
Okay,
You
now he asked me
you
that
might want
one.
to be very careful.
I'm gonna tread
careful on
lightly,
this.
but you know it's important. I'm sorry, I am gonna tread lightly, but we are trained in our society when the nice lady that sits next to you at church has just dropped 50 pounds in the most unhealthy way possible, and you can see it and tell. For us, because they lost weight, to go, you look outstanding, what are you doing? Instead of going, have you had a major diagnosis lately? You have lost a lot of weight and it's not looking healthy at all. And I know I'm making a lot of ladies upset right now, and I'm sorry. But I'm doing it for your good, I promise. Sometimes the thing that sounds too good to be true is. And some of this weight coming off is not coming off healthy. And it is obvious to the naked eye. And sometimes those people sitting next to you are doing what we've always been trained to do. You look outstanding. What are you doing to lose all that weight? And that may not be the whole story.
Two quick questions before we
That was
go
relatively
this
mild.
morning. Insurance. Does insurance pay for these injections or not?
Sometimes they do, but generally speaking, it's only if you have a diagnosis of diabetes or in some cases pre-diabetes. And otherwise, it's basically left to, are you willing to pay for this out of your own pocket?
If someone has an issue with the hurting in the lower abdomen, you guys can kind of help guide them to where they need to go, right?
Yeah, I mean, we're not going to take you out to the over-the-counter medicines and show you something to deal with this like we would a lot of times.
We'll get out the pocket knife.
Right. But because honestly we have experience with this, I'm not the only person at our pharmacy who's had their gallbladder out, right? In fact, we had one pretty recently. So there are some symptoms and times and things that we can recognize and answer your questions, whether it's being solved by medication or not. Yeah,
All right. Thank you guys for being here this morning, and hope to see you again next week.
Month.
Or maybe next month.
Oh, yeah, whatever. Help Monday with Jared and Jacob from Marble City Pharmacy. Final check on the